Occupational English Test. Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Good morning. I see we have a few things on our agenda today, especially concerning your blood pressure and the swelling in your legs. How have you been feeling overall?
It's been a bit rough, honestly. My blood pressure has been high despite the medications, and the swelling in my legs just doesn't seem to stay down unless I keep them raised most of the day. It's getting frustrating.
I understand that must be very uncomfortable. Have you noticed any changes or patterns in the swelling that might help us pinpoint something specific?
Well, it definitely gets worse throughout the day. By night, my socks leave deep marks around my ankles. Elevating my legs helps, but it's not practical during the day. I've also started using the compression stockings you recommended last time.
Good, those should help. And how about your heart palpitations? You mentioned they occur occasionally.
Yes, those are still happening. Sometimes I feel my heart suddenly beats faster, especially if I'm stressed. It's concerning, but pacemaker checks have been normal so far.
It's good to keep track of those episodes. Stress can certainly impact your heart rate. Let's also talk about your liver health. Any updates from the liver clinic?
They told me the new mass looks like a benign hemangioma. That was a relief, but I'm worried it could change, knowing my history with liver cancer.
Understandably so. We'll keep a close eye on that with regular scans. How have you been managing your arthritis and urinary incontinence?
The arthritis is as usual, some good days, some bad. I manage the pain with over-the-counter meds when it gets bad. The incontinence clamp helps, but it's not a perfect solution. I still have accidents sometimes, especially at night.
That sounds challenging. Managing these symptoms day to day can affect your quality of life. We'll see if there are other supportive measures we can suggest. Have you had any recent infections or other new health issues?
No new infections, thankfully. I stopped the sulfamethoxazole as it was upsetting my stomach, but we had talked about possibly starting it again.
Yes, preventing UTIs is important, especially given your symptoms. We'll discuss the options for that. Now let's review some of the clinical values from your recent tests to get a clearer picture.
Please do. I'm always a bit anxious about what they show.
Understandable. Your blood pressure readings from the recent visit are slightly high, with a reading of 162/90 mm on the right arm and 158/88 mm on the left arm. Your resting heart rate is stable at 78 beats per minute, which is good considering your palpitations.
That's a relief to hear.
In terms of your blood work, your serum creatinine is at 1.2 milligrams per deciliter, and your EGFR is 60 milliliters, which indicates stable kidney function. Your cholesterol levels are slightly elevated with a total cholesterol of 105 milligrams per deciliter, LDL at 130 and triglycerides at 180 milligrams per deciliter. Your liver function tests look normal, which is excellent news.
So, what should we do next?
Firstly, I'm going to increase your lisinopril dose to help better manage your blood pressure. We need to keep an eye on your kidney function and electrolytes because of the increased dose, so I'll schedule another blood test in a few weeks.
Got it, and the palpitations?
Keep monitoring heart palpitation episodes. If they increase in frequency or intensity, we might consider adjusting your heart medications. I'll also arrange for a DEXA scan to check your bone density, considering your arthritis and history of cancer treatment, which can impact your bones.
Thank you, doctor. It feels good to have a plan.
Absolutely. It's important to stay proactive about these things. Keep me updated on any changes, especially with the palpitations or swelling.
Will do. Thanks for all your help today.
You're welcome. Take care and see you soon.
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Good morning, John. How have you been feeling since your last visit?
Hello, Dr. Smith. Honestly, it's been a bit rough. I've been having more frequent headaches, and they can be quite severe at times. I'm also still concerned about my epilepsy. The last seizure was really intense and required an ICU stay.
I remember reading about your hospitalization. Can you tell me more about what happened during that seizure?
Sure. It happened suddenly. I felt this overwhelming sensation, and then everything just went blank. When I woke up, I was already in the hospital. It was frightening, not just for me, but for my family as well.
That sounds very challenging. Have you noticed anything that might be triggering these seizures?
I've tried to figure that out, but there's nothing I can pinpoint exactly. It seems random, which makes it all the more unpredictable and stressful.
Understandable. Let's also talk about your headaches. You mentioned they've been getting worse?
Yes, they're more frequent, and sometimes I just have to lie down until they pass. I'm taking aspirin, about 4 to 6 pills a day, but I'm not sure it's a good idea to continue with that much.
We'll definitely look into that. You've also mentioned some memory concerns. Could you elaborate on that?
Well, it's both frustrating and a bit scary. I struggle to remember recent conversations and sometimes even important dates. My family has noticed it too, and it's becoming a point of tension at home.
Memory issues can indeed be very distressing. We'll need to consider how your medications and overall health might be impacting your cognitive functions. You also mentioned a burning sensation around your heart. Tell me more about that.
It's like a sharp burning pain, like razors. It doesn't last long, but it's very uncomfortable. It doesn't happen often, maybe a few times a month, but when it does, it really catches my attention.
That's certainly something we should investigate further. Have there been any changes in your work life or daily activities that could be contributing to your symptoms?
I work long hours at my desk, and I've started to feel some numbness in my hands occasionally. I'm worried it might be carpal tunnel, given how much typing I do.
Occupational hazards like that are definitely worth assessing. We'll consider how your work environment and habits might be impacting your health. Lastly, how are you managing with your daily activities and overall mood?
It's a struggle, Dr. Smith. I try to keep up, but I often feel overwhelmed and anxious about my health. There are days I can't eat properly because I'm just not hungry or too stressed.
Thank you for sharing all of this, John. It's important for us to understand the full picture so we can manage your health effectively. Let's go over some of your recent clinical results to start formulating a plan.
Thank you, Dr. Smith. I appreciate that.
First, your blood pressure is at 103/85 mm/Hg, which is slightly elevated, and your heart rate is stable at 72 BPM. Your respiratory rate is normal at 16 breaths per minute, and your body temperature is also normal at 98.6. Your BMI is at 25, which is in the healthy range, and your fasting blood glucose is well controlled at 95 milligrams per Gillers. Looking at your blood work, your complete blood count is stable with a hemoglobin of 14.5 gram-Dahler, white cells at 7.2 by 10^3 UL, and platelets at 250 by 10^3 UL. Your liver and kidney functions are within normal limits, which is excellent. Your electrolytes are also balanced. The EEG showed some sharp waves, which correlates with your epilepsy, but there was no seizure activity during the test. Your EKG and chest X-ray were both normal. Based on all this, my plan is to continue monitoring your epilepsy closely. I'll refer you to a neurologist to address the headaches and review your seizure management. We need to discuss your aspirin use and potentially adjust it to avoid any gastrointestinal risks. I'd also recommend a cardiology consult for the burning sensation you've described. For your hand symptoms, an assessment for carpal tunnel syndrome seems prudent, and perhaps an ergonomic evaluation to ensure your workstation is set up properly. Lastly, given your stress and anxiety, it might be helpful to connect with a counselor or psychologist to develop better coping mechanisms.
That sounds comprehensive, Dr. Smith. I'm glad we're looking into all these aspects.
Absolutely, John. It's important we address everything that's affecting your health. Let's schedule a follow-up appointment in 6 weeks. You'll receive a notification by mail with the exact date and time. Please bring your hospital discharge paperwork next time, and in the meantime, your medication refills are processed.
Will do, Dr. Smith. Thanks for your help today.
You're welcome, John. Take care, and see you soon.